We're looking live at Toronto. Right now, that city and communities across Ontario are about to go back under tighter pandemic restrictions. CBC News is learning this morning the provincial government is bringing in a new stay-at-home order. Now, we don't have any timing yet for this announcement, but multiple sources tell CBC News it will take effect tomorrow morning at 1 minute past midnight. The new move follows calls from top public health officials in Toronto, Peel Region and Ottawa for the province to do more to contain the fast-spreading coronavirus variants. Michael Serapio has the details that CBC News has confirmed to this point. Michael, good morning.
Good morning, Heather. And we are just hours away, as you suggest, from this province-wide stay-at-home order coming into effect 12:01 a.m. early Thursday morning. It will last upwards of 4 weeks. And as for what it's going to look like, well, you can expect the following. Take a look. First and foremost, only grocery stores and pharmacies will be allowed to stay open for indoor shopping. Garden centers will be allowed to stay open. Big box stores, well, they're going to be restricted and will only be permitted to sell essentials like food and prescriptions. All other items and non-essential retailers, they will be limited to curbside pickup. Now, the move was approved by the provincial cabinet. It comes just days after that emergency brake was pulled in Ontario, and one that was largely criticized by doctors and medical professionals who pointed out these first measures did very little to curb social interactions, evident by the thousands of people who flocked to the malls and other retail outlets despite being urged to not go out over the holiday weekend. In fact, it's something that Premier Ford said shouldn't be happening. Take a listen.
Folks, you know, this variant is taking off. A lot of people were going into the malls and doing their little wander around and coming out with no bags. So that tells me they're just out for an evening or a daily jaunt. You can't do that. I'm sorry, but going to the malls is not essential. What's essential is going to buy food, going to buy medicine out of the pharmacies, and getting your vaccines.
Now, it was in that same news conference that the Premier hinted that more restrictions would be coming. The Ontario Medical Association that represents the province's doctors, they've been calling for a stay-at-home order, as has the medical officers of health for Toronto, Ottawa and Peel Region. They made a similar call earlier this week with a letter. The province has been reporting around 3,000 new cases for each day since last Friday, Heather, and hospitalizations, well, they are going up with 510 people now in ICU, the highest at any point of this pandemic. And again, a bit of the backdrop there as we now await the formal announcement of this province-wide stay-at-home order.
You know, one of the things very interesting in that, Michael, last time big box stores were allowed to open throughout the store, correct? Remember, there's a lot of criticism for that from small retailers. Why were they allowed to open for clothing and things when it was just the essential areas that people were allowed to? So a change this time round. It's going to be pharmacy and groceries in those big box stores.
Exactly.
Is there any word on what the province is going to do about schools?
Well, that's a good question, because in that letter that was signed by the medical officers of health from Toronto, Ottawa and Peel, they did ask the province to go completely online or at least bring about a hybrid model. But there's actually no indication at this point that a province-wide closure of schools is part of this current government plan, Heather. Still, as we reported, Peel Region's top doctor did order the closure of schools in Peel. That began yesterday, and we can now tell you that Toronto is going to follow suit starting today. Dr. Eileen de Villa shutting down schools in the city. It begins today again with a 2-week period, so not a lot of time for parents to react, but it is a move that Dr. de Villa is defending. It was interesting to hear her conversation with you in the last hour, and for those who missed it, take a listen to what she had to say about triggering this move to close schools in Toronto.
We were seeing more and more community activity. The cases were going up, the rates were going up in the community. And in fact, what we were seeing in our schools was a reflection of exactly that. Increased community COVID-19 transmission was manifesting itself as increased COVID-19 cases in schools. And, you know, with the greater transmissibility associated with these variants of concern, we were really left with no choice but to make that very, very difficult move.
And as you know, Heather, because it was your conversation, Dr. de Villa went on to say this is not an easy decision to close down schools, but with wider measures about to be introduced by the province, she says it should help the situation.
Michael, thank you very much.
You're welcome.